Hello, welcome my dear students. We are going to discuss on this session the various aspects of sleep and the sleep disorders. We start with the stages of sleep. And if you look behind me, what I have written on this board is non-rapid eye movement sleep and rapid eye movement sleep. When there's rapid eye movement, the brain electrical activity is still working, and this is why it's called paradoxical sleep. Whereas the non-rapid eye movement sleep is divided into stages 0, 1, 2, 3, 4 and passes through the various waves on the EEG, namely beta, alpha, theta and delta, and as you go down and down, the waves go on becoming slower and slower and the electrical activity of the brain goes on decreasing and you go on to the deeper and deeper kind of sleep. So theta waves and delta waves, presence of these is going to indicate a deeper type of sleep. Let's go to the slide now. On this slide, I have shown the various stages of sleep. The first column is telling you about the stages, the naming of the stages. That's stage 0, 1, 2, 3 and 4. And I would like to draw your attention to 3 and 4, which are made bold. And these are the deep types of sleep. The last row is speaking about the rapid eye movement sleep, which is paradoxical sleep. Let's start with the first row, stage 0. This is called the stage of being awake, and it occupies about 1 to 2% of total sleep duration, and the predominant wave is shown on the last column. That's the beta wave, and it's 15 to 35 CPS is cycles per second. In this particular stage, that's stage 0, the eyes are open, and this is mainly getting the beta waves from the frontal region. The alpha waves, 8 to 14 cycles per second, appear when the eyes are closed, and the waves appear from the occipital and the parietal cortex. The next stage is stage 1, that's called stage of dozing, and occupies 3 to 6% of the total sleep time. And in this you have alpha waves with theta waves. So what I said in the beginning, it starts with beta waves when the eyes are open. When the eyes are closed, it's alpha waves. And when you go on going into the deeper and deeper stages, the next wave to appear is a theta wave. So in the stage 1, that stage of dozing, you have alpha waves with theta waves. Theta waves are about 3 to 7 cycles per second. Let's move on to the next row. That stage 2 is called unequivocal sleep, and this occupies the largest amount of time, that's 40 to 50% of the time. And here you have theta waves. Along with this, you also have spindles and K complexes. The spindles are about 12 to 14 cycles per second. During the unequivocal sleep, the patient is quite arousable. And during this stage 2 sleep, unequivocal sleep, which is called stage 2 sleep, you get the phenomenon of tooth grinding, which is called bruxism, is very characteristic of stage 2. Let's go to the next row, and the next row is highlighted because we are entering comparatively deeper type of sleep. That's stage 3. It's not exactly called deep sleep, it's called deep sleep transition, and we spend about 5 to 8% of time in this. The previous wave for the stage 2 sleep was theta, so theta is still present, that's 3 to 7 cycles per second. And the next wave to appear is the last one, that's delta wave, is only 0.5 to 3 cycles per second. Along with this, there may be some spindles. In the deep sleep transition, that is stage 3, the patient is not easily arousable. And some of the phenomena associated with stage 3 sleep is the nocturnal enuresis, is the passing of urine in some patients, somnambulism, that is sleepwalking, and the night terrors are the very fearful dreams which are not remembered the next morning. That's night terror. So enuresis, somnambulism and night terrors are the characteristics of stage 3 sleep. We move on to the next row, and that's stage 4 sleep. That's the last stage of the non-rapid eye movement sleep, and this is the real deep sleep. This is called cerebral sleep and occupies about 10 to 20% of the time, and the most predominant wave in this sleep is just delta wave. That's just 0.5 to 3 cycles per second, and the patient is difficult to arouse from this sleep because this is the deep sleep. Again, in this sleep, the phenomena which may be observed is nocturnal enuresis, somnambulism, and night terrors. It's very obvious if the patient has enuresis. Obviously, the patient doesn't know, the patient doesn't understand, so it's a deep type of sleep. Somnambulism, the patient is walking during the sleep and the patient doesn't realize, the patient doesn't understand. It means it is a deep type of sleep. And the last phenomenon seen in this is the night terrors, are the fearful dreams which are not recalled after waking up. So again, that's a deep sleep. So 0, 1, 2, 3, 4 are the non-rapid eye movement types of sleep. Next we go to the REM sleep that occupies about 20 to 30% of the time, and it's called paradoxical sleep because the brain electrical activity is intact. And during the REM sleep, you get all types of waves, the waves of all frequencies, beta, alpha, there are no K complexes, and if there's a dream during this particular sleep, you can recall the dream after waking because your brain was active. The erection of the sex organs is also seen during the REM sleep, that's the paradoxical sleep, and the dreams which are recalled may be fearful dreams, but which we recall are called nightmares. So please try to differentiate between the two words, night terrors and nightmares. Nightmares are the ones which are recalled. You can tell others what was your dream, so that is happening during the REM sleep. Whereas night terror is a supposedly fearful dream which is not recalled because it happens either during the stage 3 or the stage 4 type of sleep. So that is during deep sleep transition or cerebral sleep. So these are the deep types of sleep in which predominantly delta waves are present. So that's regarding the various stages of sleep. Have a look at the table and let's revise once again. The non-REM sleep 0, 1, 2, 3, 4, awake, dozing, unequivocal sleep, deep sleep transition, and cerebral sleep. Please follow me with the last column as you go down and down. In the stage 0, there is beta and alpha. In the stage 1, alpha and theta. In the stage 2, theta and spindles and K complexes. In the stage 3, theta and delta. And the final, that is stage 4, only delta. And the last one is totally different. That's rapid eye movement sleep, waves of all frequencies. Enuresis, somnambulism, and night terrors, typical of stage 3 and 4 sleep. Tooth grinding or bruxism, typical of stage 2 sleep. And the nightmares, the recallable dreams, and erection is typical of the rapid eye movement sleep. Let me take you to the next slide to classify the various sleep disorders. The first type of sleep disorders is called dysomnias. Dys stands for a disturbance. What is the disturbance? Disturbance in the timing, in the quality, and the total amount of sleep. All this will be called dysomnias. And on this one slide, you have various types of dysomnias. This includes number 1, insomnia, there is lack of sleep. Breathing related sleep disorders. Narcolepsy is opposite of insomnia. Then there's hypersomnias. There are circadian rhythm sleep disorders, restless legs syndrome, sleep drunkenness, and nocturnal myoclonus. All these are the various types of sleep disorders categorized under dysomnias. All these dysomnias are now shown on the next slide, the important ones, and let's do them one by one. Insomnia. The patient should have a feeling of lack of sleep at least 3 times in a week for a period of 1 month. Then you diagnose it as insomnia. To repeat, the disturbance of sleep, the feeling of disturbed sleep, at least 3 times a week for a period of 1 month. And what is written in front of insomnia is how to manage. Some important factors to be managed. Number 1, avoid caffeine intake. That's very important. Second one, try to follow the sleep hygiene, the sleep rituals. Next, go for a regular exercise, go for stimulus control, the stimulus which is making you not to sleep, and lastly you can go for drug treatment in the form of hypnosedative drugs, benzodiazepines or the newer non-benzodiazepines. Next we go to breathing related sleep disorders. The breathing related sleep disorder may be central or obstructive. In the central breathing related sleep disorder, the airway is open and there is little effort. Whereas in the obstructive breathing related sleep disorders, for example, obstructive sleep apnea, there is a definite obstruction in the airway. The management includes weight loss, because this is commonly seen in obese patients, then using CPAP machines, and sometimes tonsillectomy, uvuloplasty and tracheostomy are the final measures to be taken. Next we go to narcolepsy, that is excess sleep, and there are some important associations in narcolepsy which we need to remember. The first one is called cataplexy. I hope you are looking at the slide. Cataplexy. Cataplexy is the loss of muscle tone and a sudden collapse in response to a strong emotional stimulus. This is associated in patients with narcolepsy. To repeat, sudden loss of muscle tone and sudden collapse in response to a strong emotional stimulus can happen in these patients and is called as cataplexy. The next important association with narcolepsy is called sleep paralysis. Sleep paralysis is inability to move the body few seconds after waking up. The patient is awake and the patient is able to realize that the patient is awake but is not able to move the body at all for a few seconds. This is called sleep paralysis. The next association with narcolepsy is hallucinations. And these hallucinations are of two types. Number one, the patient gets hallucinations while falling asleep, or the patient gets the hallucination while waking up. If the patient gets hallucinations while falling asleep, it is called hypnagogic type of hallucinations. If the hallucinations are present while waking up, it's called hypnopompic type of hallucinations. The management of narcolepsy obviously involves central nervous system stimulant drugs as well as the treatment with antidepressant medications. We move on to the next row. Next row is showing you the circadian sleep rhythm disorders. These are of various types, maybe delayed sleep phase type, jet lag type or shift work type. Those who are traveling may experience the jet lag type circadian sleep rhythm disorder, and the workers who are working in various shifts, changing shifts, may experience the shift work type of circadian sleep rhythm disorder. The various measures taken are shown in front of it, thus adjusting the sleep timings, adjusting the sleep with the destination, and sometimes daytime light therapy might be useful to treat the circadian sleep rhythm disorders. Lastly, you have two disorders related to dysomnias. One is the restless leg syndrome and the second one is nocturnal myoclonus. In restless leg syndrome as well as the nocturnal myoclonus, it has been found that there could be deficiency of dopamine in the brain, and this could be recovered by giving treatment with levodopa, which is a prodrug of dopamine. So if you look at in front of the restless leg syndromes and the nocturnal myoclonus, both the rows are writing levodopa. This is important to remember. In addition to this, in the restless leg syndromes, iron supplementation may be useful and the magnesium supplementation may be useful. In nocturnal myoclonus, levodopa is one modality of treatment. In addition to this, you can use benzodiazepines. You can use an anti-malarial drug, quinine, which has produced response in nocturnal myoclonus, and you can use opioid type of drugs. So that's regarding the dysomnias. Once again, to revise, it includes two opposite disorders, insomnia and narcolepsy, includes breathing related disorders, includes circadian rhythm sleep disorders, and restless leg syndrome and the nocturnal myoclonus. We go to the next slide to discuss the disorders which are called parasomnias. The previous one was dysomnias, and it was about the timing, quality, and the duration of sleep. Parasomnia is about the abnormal physiology or behavior associated with sleep. And let's have a look at this slide, and you know the various disorders. Number one is bruxism, that is tooth grinding during the sleep. Next one is nightmare disorder. I hope I have adequately trained you to know what is nightmare and what is night terror. So the next one is nightmare disorder, and the second one is sleep terror disorder or the night terror disorder. Next is somnambulism or sleepwalking disorder, and the last one is REM behavior disorder. So these are the parasomnias: tooth grinding, nightmare and night terror, sleepwalking, and REM behavior disorder. Let's go to the slide to see what are the parasomnias. Number one is bruxism. It's a typical habit of tooth grinding, and as we already discussed, it's a characteristic of stage 2 sleep. There may be tooth damage, there may be jaw pain, and corrective orthodontics might be required to treat this. The nightmare disorder is frightening dreams with recall, and I hope you remember I said if you're able to recall your dream, it's called nightmare, and obviously it happens during the REM sleep, that is rapid eye movement sleep. And the drugs which may be useful to manage this is the TCAs, that's tricyclic antidepressant drugs, as well as benzodiazepines. The next row is sleep terror disorder, which is also called night terror or is called pavor nocturnus. There are frightening dreams, supposedly frightening dreams, because the patient is not going to recall what happened during that particular phase. So I am saying frightening dreams without recall. The patient appears awakened, the patient shouts, screams, and when you ask the patient what happened, the patient doesn't remember anything, because it's happening during the stage 3 or stage 4 sleep, that is delta sleep or slow wave sleep. The patient cannot be awakened from this particular sleep because the electrical activity is minimal. And the drugs which may be useful again in sleep terror disorder is the benzodiazepines. We go to the next row, and next row is speaking about somnambulism or sleepwalking disorder. Please remember, it happens during delta sleep, maybe stage 3 or stage 4. The onset of this sleepwalking may be during childhood. It may be associated with enuresis, and there may be genetic factors involvement in the pathophysiology of somnambulism. Again, the drugs which are going to be useful is benzodiazepines. The last row is REM sleep behavior disorder. What is this? This is REM sleep and dreaming without muscle atonia. Normally you are supposed to get the atonia in the muscle, but in this there is no muscle atonia, without muscle atonia. And the result can be, because the muscles have got a lot of tone, this patient can harm itself. So the patients may harm themselves, or the patient may harm others. This is going to be a dangerous phenomenon. That's called REM sleep behavior disorder, where there is no muscle atonia. The drugs useful may be anticonvulsant drugs like carbamazepine and of course benzodiazepine. I request you to go to this slide, review this slide once again, right from the second row, third row, fourth row, and the last row. Everywhere you find a word BZD. So please don't forget benzodiazepines, extremely useful in the management of parasomnias. I hope you like this particular module. I tried to make it in a very concise way. I tried to explain the stages of sleep, what happens during each particular stage, and what are the characteristic associations of each stage. Let's just try to recall without looking at the slide. Bruxism or tooth grinding, characteristic for stage 2 sleep. Erection and nightmares, that is recallable dreams, characteristic for REM sleep, that is rapid eye movement sleep. And the night terror, when the dream is not recalled at all, as well as somnambulism, is very typical of deep sleep, that is stage 3 sleep or stage 4 sleep. Stage 4 is the deepest type of sleep, which is called cerebral sleep, and the predominant waves are delta, and the electrical activity is least, and the delta waves is just 0.5 to 3 cycles per second. So the stage 4 sleep is also called slow wave sleep. You can also include stage 3 when you want to speak about the slow wave sleep, 3 and 4, and stage 4 is called delta sleep, and this is the deepest type of sleep. I hope this module was interesting, was short, and is going to be useful to you. Make a good use of it. I wish you good luck. Thanks for listening.